Good afternoon, everyone, and welcome, and welcome back. And but anyways, just want, as you know, the city of Worcester has been placed in the red category, which is a high-risk category as defined by the Department of Public Health, along with 17 other communities in the state of Massachusetts. Now, over the last 3 weeks, we've seen a slow but steady increase in COVID-19 cases in the city of Worcester. We've averaged 9.5 cases per 100,000 over the last 14 days. In all, there have been 6,132 confirmed positive cases in the city of Worcester since the start of the pandemic. Now, Mr. Augustus, city manager, will give you the numbers where we are today. You can see the numbers have gone down, and hopefully that will continue over the next couple of weeks. As a city, we are still in good shape with capacity in our healthcare system, but we are still encouraging everyone to continue the all safety precautions that have been in place since March. This is the only way we're going to get through this. It's been pandemic as a city and as a country, so we have to do our part. Like I open up every press conference: good hygiene, wash your hands, wear your mask, sneeze into your elbow, use hand sanitizers, but you got to mask up. I think that Dr. Fauci and others are talking about how important the masks are. The CDC is talking about that too. So I'm just going to keep on emphasizing that. Every time, for every business, for every store you visit, wherever you leave your house, please wear your mask. I think that's probably one of the most important things that you can do. And please continue to socially distance. Do not attend large gatherings, over 50 outside and 25 inside. Please continue practicing social distance wherever possible. As you know, flu season is also coming. So we have, as a city, been providing flu vaccines along with COVID-19 testing. We're doing this to help prevent the wave of flu cases that often occupies hospital beds during the flu season. With colder weather coming, we are all anticipating an increase in COVID cases, and we need to help keep our hospitals beds open for possible incoming patients. Testing of flu vaccines will be offered again. We've been offering them over the last several weeks, but again on Monday, September 21st from 2 to 6 p.m. at McCady Field on Dorchester Street, and on Wednesday, September 23rd from 2 p.m. to 6 p.m. at University Park across from Clark University. Now I'm going to turn it over to City Manager Augustus, then to our Director of Medicine, Dr. Hirsch, who will provide some more specifics and numbers for you. And again, I'm just going to emphasize, everybody, you know, as a city, we're doing pretty good still. I can see us trending downwards, but you have to be vigilant as we enter into the cold season, as people go indoors. We can't let our guard down. That's what I'm going to emphasize every single time I speak. Don't let your guard down. Keep your masks on, social distance, and practice good hygiene. Thank you. Mr. Manager.
Thank you, Mr. Mayor. As the Mayor mentioned, the Commonwealth has moved Worcester's designation into the red zone, indicating that we have a rate of average daily cases that are greater than 8 per 100,000, and this is the trigger point or the threshold for that designation. Worcester is at 9.49 average daily cases per 100,000 over the last 14 days. 3 consecutive weeks we've seen increases in new cases. Last week's positivity rate, the week of September 6th through the 12th, was 5.59%. That's the highest since the week of June 14th to the 20th, which was at 4.79%. We are still significantly below that 10% threshold for positivity that would trigger a rollback. And we have been below that 10% figure since the last week of May, early June. As the Mayor mentioned, to date there have been 6,132 confirmed positive cases in the city of Worcester. And this past week, we have received 106 new positive cases in the city of Worcester. So the week preceding, we had 140 new cases. This week, we had 106 new cases. That's good news. That means this week's caseload is 34 less than last week's caseload. So those 3 weeks of ever increasing numbers week after week has, at least for this past week, gone down, and we're hoping that with increased awareness and attention, particularly with this new designation, this is an opportunity for everybody to redouble their efforts and recommit their own everyday activities to adhering to the protocols that the mayor discussed and that we've been talking about for these last many months. Worcester, the city of Worcester proper, has had 287 deaths from the coronavirus. Our hospital system, UMass Memorial and St. Vincent, have had a total of 375 total deaths. The hospital system obviously serves the region, and so some of those deaths are for communities around the city of Worcester. Worcester is a regional health alliance, the lead on the regional health alliance, so we provide public health services as well as public health nursing services for some of our area communities. And so I'm going to share those numbers with you. The town of Shrewsbury has 5 new cases from the previous week, bringing their total to 387. Town of Holden, 3 additional cases, bringing their count to 152. The town of Grafton, 1 new case, their total 113. Town of Leicester, 2 new cases, bringing their total to 174. And the town of Millbury, 2 new cases, bringing their total to 286. So there are now 17 communities in the Commonwealth that are in the red zone designation, which carries with it the moniker of high risk for COVID transmission. We take that very seriously. And again, it is an opportunity for all of us to redouble our efforts and not fall victim to the fatigue that I understand many people experience, wearing the masks and social distancing and the hand washing and all those things. Now is not the time to let our guard down. And this is a reminder that this virus will come back quickly if we do let our guard down. This designation does bring with it some additional state resources, which we are very appreciative of. The state has been a great partner, not only in helping us track these cases, but also providing resources to partner with the city of Worcester so that we can arrest this increase in cases and turn the numbers back. We will be meeting with the state tomorrow to talk about what those array of additional services are, but we're expecting more help around education campaigns, more testing assistance, as well as more enforcement assistance from the Commonwealth. We'll continue, as we have since the beginning of this, to review our protocols, and each new season brings new questions. Obviously, there have been a lot of conversations around the reopening of school, colleges coming back, the things that tend to happen at the end of the summer and the beginning of the fall. And we've all been working closely with our partners in the Worcester Public Schools, our parochial school partners, as well as our colleges and universities here in the city. The mayor and I and Dr. Hirsch have had a chance to tour many of the college campuses to see firsthand the protocols they've put in place, the surveillance testing, the seriousness that they're all taking their responsibilities around testing, preventing the spread, isolating students, educating students, staff, and faculty. So I want to make sure I'm clear that we are very pleased and appreciative of the seriousness with which the college community has taken their responsibilities, and they have been in very close contact with the city every step of the way. And we appreciate that partnership and looking forward to that continuing as we together as a community navigate our way through this. Large gatherings do remain an issue, and we're particularly seeing some large family gatherings. So we appreciate the instinct of many people to connect with their families, particularly around birthdays or holiday weekends or other occasions that naturally families want to get together and celebrate. However, when families live in 3 or 4 different houses, maybe from different communities, and they gather together to have these celebrations, they still need to make sure they're following those protocols, those social distancing, those mask wearing protocols. Because you think about that, when we let our guard down, unknowingly we're passing it to each other within those family gatherings. And then those family members go and work or go out into the community. And one of those family members may work in a nursing home or a long-term care facility, and they unknowingly continue the spread in the community. We saw just a couple weeks ago one family with 8 cases in that one family. So this is a place that we need to stay focused. Even though they're family members, if you're not living in the same household, you need to follow those same protocols and those same guidelines to keep yourself, your family, and your community safe. We have done a number of Stop the Spread testing campaigns in partnership with the UMass Memorial Health System and with the support of the Commonwealth of Massachusetts. We've done 10 sites so far. Those testing sites, Stop the Spread testing sites, have done just under 5,000 tests, 4,914 to be exact. They've had a 2% positivity rate. So again, that's a very good sign. We will continue to do those Stop the Spread testing sites. We are particularly focused on the vulnerable parts of our population, communities that disproportionately are essential workers. They're workers in our supermarkets and our healthcare institutions, and we're really making sure that we're reaching out to those communities to make sure they can take advantage of not only the testing, but the educational opportunities that are at those sites. But as the mayor mentioned, we really are trying to get the flu vaccine as universally administered throughout our community as possible. And those testing sites are providing free flu vaccines at the same time. That really is critical as we go into the flu season and to the colder weather. I know Secretary Sutters recently talked about last flu season. There were 40,000 influenza cases in Massachusetts. Those 40,000 cases resulted in 55,000 ER visits and more than 6,600 deaths. So the flu in and of itself is a danger to the public health. You combine the flu with COVID, and it adds to the confusion about whether your symptoms are the flu or COVID. They drive up the number of people who are going to the hospitals, to the doctor's offices, to the ReadyMeds, and to the other facilities. And so it really is important that we try to take one of those factors, one of those unknowns out of the equation to the extent that we can. All of us are anxiously waiting the COVID vaccine, but we do have a flu vaccine available mostly free of charge through your insurance, or there are a number of other programs like the Stop the Spread that will provide that free flu vaccine. Never more important that every single person in our community, whether you fit into a vulnerable category or not, take advantage of that flu vaccine. Help yourself, help our community as we go into the flu season. I'm going to turn it over to Dr. Hirsch now for his update. Thanks.
Thanks, Mr. Manager, and thanks, Mayor Petty. I think at the end of all of this COVID, one of those 11 institutions of higher learning that we have in Worcester, and we're so grateful for that, ought to give both of these guys epidemiology degrees, because they have a better grasp of this than about 90% of the people I meet, either in the hospital or on the street. And I think the mayor and the city manager hit the nail on the head. We are in the red now, but I think the overall feeling that we had was, despite that, with all of these pop-up testing sites that we've been doing with the Stop the Spread initiative in the most vulnerable populations, we've consistently seen positivity rates of less than 2%. And on the very positive side, something that the city manager mentioned, our hospital occupancy with COVID positive patients is way, way, way down. So we are not back in March and April and May. We have about a total between the two hospitals of about 11 positive patients right now. So we are still testing everyone that comes in with a fever or a cough for COVID, but we're not finding that this new wave of positivity is causing increased hospitalizations. So that's really wonderful. But it also tells us that when you don't feel any symptoms, you can be carrying this virus. And that's exactly what the city manager was just describing. You feel fine, you go out and about. If you're not wearing a mask, if you're not distancing, if you're not doing the kind of things that's going to clean off the surfaces that you were just at, your coworkers, your family, your loved ones are going to get exposed, and that's how this can spread more vigorously. So that's really where it's at. Dr. Redfield yesterday at the CDC in front of Congress said that right now, until we have the vaccine available for the COVID virus, and that's probably not going to be until realistically sometime in mid-2021, that it is widely distributed with a booster shot about 3 months after the initial dosing has been done. This is our best friend. The mask is our best friend, and we have to continue to push to wear it. I was on the phone earlier today with a woman who had been at a Stop and Shop and said that a gentleman had been walking around without a mask and deliberately kind of coming very close with a lot of the patrons, and the store manager could not easily eject this person. So this has really become kind of a political issue, which it shouldn't be. The mask is something that you're doing for yourself, but you're also helping the community. And I don't think that should be a political thing. And Worcester has not been that kind of a community. We have pitched in, and that's really what has mitigated the virus effect here, so that we never had the overwhelming of our hospital systems that other communities had. And it involved a lot of foresight from the city manager, from the medical centers, from the community health centers. I keep in touch with all those medical facilities on a weekly basis. They're very, very happy with where we are, but we know that the virus is out there and it's very transmissible. So we're fighting a very, very difficult enemy. And I think the only thing we can say is that I'm hoping tomorrow's discussion with the state will give us some more resources, because the contact tracing, if we can accelerate it, muscle it up, it may mitigate some spread if there's been exposures. I have a lot of tremendous respect for the colleges, what they've been trying to do to kind of keep a lid on the natural tendency of college students to want to congregate and hang out. We don't want to stigmatize college students as being typhoid Marys. They're wonderful additions to the community. They bring a wealth of brains and fun and energy, and we want to encourage that. But at the same time, we realize that they can be vectors of this virus very easily, and the colleges have been great talking to our Department of Public Health on a weekly basis, and we feel very confident that we'll keep this under control. Similarly, Superintendent Benenda has been amazing in terms of kind of trying to navigate what to do with the public schools and the different populations that inhabit those schools, and she's been extremely conservative and safe. It's not an easy decision to make to keep a kid out of school. We know there's a lot of pressures for parents to get their kids back to school, because psychologically it's a great benefit, but right now in the red zone we have to really put the brakes on a certain amount of things that we would have hoped might have been able to progress more swiftly over the next couple of weeks. The last thing I'll say is usually at these press conferences I always gave a little history thing, because that's my thing. So today is the 80th anniversary of Adolf Hitler deciding that he could not invade the British Isles. And we've made a lot of references, and I know the city manager is quite a Winston Churchill fan, so am I, about this is kind of like the Battle of Britain, in that we're fighting an enemy that is very, very tenacious and is tough to deal with, and this virus is really tough to deal with. But the tenacity that the Brits showed in being outnumbered and surrounded and having bombings going on in all of their major cities for months and months, they held out, and Hitler gave up. So I'm hoping that the virus is going to give up too. We have to get a few more weapons, like Brits had the Spitfire airplane. We need the COVID vaccine to be our Spitfire. But once we get that, I think we're going to find that the new normal that we have is going to establish a lot more sense of community than we've ever had, because we pulled together to do this. And I know we can continue to work together to get us back into the yellow and even into the green. So that's what I have today.
We have any questions or?
Can we hear from the superintendent for a second?
Sure. You have a question for her?
Yes, I do.
Okay. We can hear you.
We understand that you've suspended school sports. Can you just speak to the what was behind that and what we're looking forward to next? I know fall 2 we want to see sports come back.
Sure. So the guidance that came from both the Department of Elementary and Secondary Ed, as well as the MIAA, stated that once you start your sports season, if your community goes to a red, then all sports are permanently suspended for that whole time. And you can, again, make the sports up in fall season 2. So for the Worcester Public Schools, the official start of sports was tomorrow. And so we called the commissioner and the MIA today to say that we went red yesterday. We're not currently in our season. So would we be able to just postpone and wait to see if the red goes down and we go back into yellow, and that we could resume sports for the fall season? So the response is that right now they're postponed, and there's new guidance coming out both from DESE and MIAA next Tuesday, and we are going to postpone until we hear that. So that's where we're at right now. Are there any more other questions?
I had a feeling for the students, I guess. I mean, knowing that they look.
So I think the students were disappointed. This week, the coaches have been collecting all the required forms, and tomorrow was the first day of practice. And so I'm sure the students are disappointed because they've been, if they're doing cross country, they've been practicing running on their own, and we were doing cross-country, golf, field hockey, and soccer. So students have been looking forward to that and practicing, but we want to do what's safe for everybody. So at this time, we've suspended all sports.
I have a question about, you said that some of these family gatherings can be an issue. How do you enforce that better? Do you have a plan to help with that?
To be honest, it's going to be really hard to do that. People are in their backyards or in their homes having these gatherings. It really is methods like this, bringing awareness, reminding people about their shared responsibilities, not only to their family members, but many of those family members work in the community. They go out shopping, and if they've contracted the virus, it is easily spread to other folks. So if we get complaints, we certainly follow up on those, but this is going to be a matter mostly of personal responsibility. Yeah.
I've seen, or Dr. Hirsch or Joe, just since yesterday even, I've seen some sort of chatter among people saying, sort of putting 2 and 2 together about the start of college with this pushing us into the red zone. And you didn't come out and specifically say, you've had more detail in the past about where these cases are coming from. Can you say that, these new cases over the past couple of weeks, are they a small percentage of college students, or is it negligible, or?
It really is, since the college have been back, some of them 2 or 3 weeks now. They're small enough numbers that they are not enough to account for significant increases in the numbers. So, every case adds up to, the numbers that we have each week, and so as we go week to week, every case counts toward that number. But it isn't clear to me that the colleges are a significant source of the reason that we've moved into red. They're part of the mix with the new cases, but you may get half a dozen across the campuses any given week, and so that's not a huge driver of these numbers.
Have any fines been issued in relation to large gatherings or for businesses regarding regulations?
I think we've had about 7 citations given by the city, and the Commonwealth has done some citations as well because they're also doing their enforcement. We've done close to 400 visits based on complaints. We usually try to start with warnings, and then if people are able to make the adjustments necessary, a fine isn't required. The goal really is compliance. At the end of the day, that's what we want, compliance. We'll do the fines if we see a pattern of behavior or people unwilling to comply, but the goal is to get people to do the right thing for their business as well as the community.
I just have
Did
one
you-
more question for Ed and Dr. Hirsch. The numbers, when the state comes out on Wednesday with their numbers, usually the city comes out on Thursday. They're not always the same. And if you looked at actually at the state numbers week to week, from this week to last week, it was an increase of about 147 cases. Is there a technical explanation for that you know of? Or?
Steve, when we drill down on some of the discrepancies, what we find is that initially someone might be reported out of a college as being a Worcester case who ends up really being a resident of Medford or some other place where they really should be counted in that community's numbers. And the opposite happens as well, that somebody out in another college tests positive, turns out to be a Worcester person, and then we get that person. So they're not as accurate as probably we would like, but they're as close as we can get to showing us trends. And one of the trends, again, that the city manager referenced, from the very beginning of the pandemic, we have tested about 62,000 people here in Worcester for the virus, and about 5,800 have been positive. So what that tells us is that we have a 9% community rate from the beginnings, from middle of March when we first declared the pandemic here. So that's been a steady decrease. When I was doing these press conferences with you all in June, and we were still in the high 20s at that point for percentage. So we've continued to come down the entire summer, and I think that's still a very positive thing. But the numbers are the numbers, and their triggering of this red zone, I think, is a great thing, because it's going to give us the support of the state, and it's going to wake everybody up. And I think that's what we were trying to do here today. And I hope people take it seriously, because they have it in their power individually to help the entire community fight this off and get back to things like school sports. And we don't want to go backwards to the point where we're going to be taking away outdoor dining or retail shopping and things like that. So we've got to really work together to make this happen.
And then just one small, I don't want to get into the weeds on the numbers too much, but like you said, 62,000 have been tested in the city so far. But if you look on the state, the weekly numbers from the state, it says like 133,000, which is almost getting to be almost everybody. But is that because you had one person getting tested twice? Or
Yes,
something?
yes. There's many people that have gotten multiple tests. And for example, at institutions like the medical school, they're testing people twice a week, weekly. So,
Because that rate gives you that goes down to like 4% if you did a rate on that. So
Right.
That's not a true picture of the disease.
correct.
Thank you.
I have a question for the city manager. Some other communities have restricted access to city and town resources when they move into their high-risk red zone, like, making parks off limits or mask mandates, things like that. Are these things you see Worcester considering at some point?
Yeah, I think in the conversation that we have with the state tomorrow, we'll talk about what they recommend as any additional moves. We instituted the mask requirement in Worcester about 2 weeks before the state did. So we've embraced the notion of wearing masks earlier on. The parks, we really do want people to be able to get outside and get that exercise that they need. But we have, removed basketball hoops in many of our locations to try to make sure people aren't doing some of the activities that are really the more problematic. But going out for walks, for hikes, other things that allow them to stay active but also, safe. It's something we'd like to continue if at all possible, but we're going to work with the state if there's any additional recommendations that we should be taking.
Everybody all set? Thanks for coming out. Hopefully we won't see you for a while. We'll see you.